Hello guys, welcome to my live stream, and I want to make this a frequent thing whereby every day at 8:45 p.m. we'll be doing a live session on a few health conditions, and if you have any questions feel free to ask at the chat box. Now today I want to talk about colorectal cancer, and it's really sad that we have seen this disease consuming taking the lives of young prominent people who are role models to us, examples being our late MP, our late Kibera MP, that is Honorable Ken Okoth. And so what this means is that we have to know that as much as they say that most cancers are mostly for the old people, it's not always so. And so as young as you are, it's very important that you have sufficient information on what some conditions are. So as I said, I'm talking about colorectal cancer, and just from the condition, it means this is a cancer that interferes with your large intestine. When we talk about colorectal, that is basically your large intestine. And this cancer can actually affect any part of your large intestine. It can affect your cecum, it can affect, you have your large intestine is I'm trying to find a way in which I'm going to put, but so your large intestine has different parts. So you will have, as it ascends, you have what you call the ascending colon, that is still part of the large intestine. Then around this area, you have what you call the transverse colon. So it can affect any part of the colon, but the most affected part of the colon is actually the sigmoid part of the colon, which is on the left side. Now when you talk about a cancer, what this means is that you have an abnormal growth that is interfering with your system. It's either causing an obstruction or it's consuming energy. It's basically interfering with your system. And now cancer is a problem because it ends up messing the stability of a person. So that is it with now colorectal cancer. So you have a mass that can grow in any part of the colon, and it can cause either an obstruction or it can interfere with the it can consume a lot of energy, cause increased metabolism, so you find people losing a lot of weight. Now, what are the risk factors for colorectal cancer? When it comes, first, before I go to the risk factors, what you must know is that colorectal cancer is just not merely a disease of the old. So though mostly in many cases it tends to affect the old people, but you have a category of colorectal cancers that will affect even the very young people. And these these are those conditions that mainly tend to run in families, so that you find a person as young as 40 years old, 41, 42, 43 years old. Recently we lost a superstar in the Wakanda Forever because of colorectal cancer. Now, some of the risk factors for colorectal cancer, we have those risk factors that you can have control over as a person, but then we have those risk factors that you just cannot have control. They are there and you cannot do anything about it. Now, the risk factors that you can have control over, what you call the modifiable risk factors, mainly revolve around diet and our lifestyle factors. Now, so nutrition actually plays a vital role in just giving you like a giving you some form of protection against colorectal cancer. And some diets such as red meat, processed foods have been found and thought to contribute. But that's not the only thing diet is not the only thing that will actually make you have colorectal cancer. There's a whole interplay of various factors, environmental factors, and genetic factors, and also lifestyle conditions, such as nowadays many people are consuming alcohol, smoking, and obesity. Those are the controllable risk factors for colorectal cancer. But then we have the non-controllable risk factors where you literally cannot do anything about it. So things like age, as I have said, it's more common in old people, but remember the young are not an exception to colorectal cancer. It tends to be more common among males than among female. And then we also have genetics play a crucial role in colorectal cancer. You have some sporadic cases which come about because of certain mutations, and this contributes greatly to you having colorectal cancer. Now, if a person has colorectal cancer, but then if you have a question, just feel free to, if you have a question or a contribution, it's just going to be a 10-minute live, at most 15 minutes, so that you can all go and watch the 9 p.m. news. So if you have a question or a contribution, just feel free to write on the chat box. So a person with colorectal cancer, so I've said it's affecting your large intestine, and you have something that's abnormally, that is growing at a faster rate than the way the normal cells are growing. And so these people tend, if you have colorectal cancer, you tend to experience abdominal pain, that is pain in your abdomen area. And then because it's affecting your large intestines, you find that there tends to be changes in bowel habits, whereby you can have constipation, diarrhea. At one moment you're having constipation, at another moment you're having diarrhea. And an important thing, bleeding can happen in such a way that you get that whatever stool you're releasing has blood in it. And many times this blood could be what we call melena. It's black in color. So sometimes when you're getting black stools, that could actually be a sign that you're bleeding, and it's really important to go to the doctor. That's why it's very important. When I go to the loo, I make sure to check what's the color of my stool. Thank you, Moses. I see. I'm glad that you're enjoying this. So when I go to help myself, I always check what's the color of my stool, and that is really important. So in regards to bowel habits, I've said you can have alternating periods of either constipation or diarrhea. And I've said it's, you see, you have a mass that is causing a block on your rectum, and you tend to have your stool content, like narrowing of stool. You get what you call pencil thin stools, because you see your stool is struggling to pass through an obstruction. So that is it with colorectal cancer. And then other things also come in play. I've said bleeding can happen, and when bleeding happens, what this means is that you're losing blood and you can become anemic. When you become anemic, you can have things such as difficulty in breathing, you tend to have things such as chest pains, you get tired very easily. And because you have a cancer in your body, other constitutive symptoms also come into play. So many people with cancers, not only colorectal cancers, but many types of cancers, tend to have weight loss. So actually, if you're experiencing weight loss and you're not trying to diet, you're eating well, but you're experiencing weight loss, it doesn't mean you have cancer, but it's very important to go to the hospital and just inquire, why am I having this weight loss? And also other constitutive signs and symptoms in such people is that there tend to be a lot of sweating, a lot of night sweats, and fever or hot body temperatures can also come in play. Why it is important for you to actually know about this thing is that the problem with colorectal cancer, yes, it's affecting the colon, but this cancer can actually spread to other parts of your body, and it becomes really bad when it spreads to other parts of your body, because that makes management quite hard and difficult. Okay, so you can have this cancer can actually spread from your colon to adjacent structures, to structures that are just closer to colon, either the small intestine or just structures around the colon. But then it can also spread to areas far away from the colon. And this spread of these cancer cells could either be through your blood, that is your circulation system, hematogenous spread, or through your lymphatics, all right? So in most cases, you can find that you have this colorectal cancer, and it goes and affects either your liver, it goes and affects either your lungs, affects your bones, or even goes and affects your brain. And so in cases where if it goes and affects the liver, you find that you start presenting with things such as pain around this area, what you call the right upper quadrant, because that's where the liver is located. If it goes and affects your lungs, then you find that you have things such as issues with breathing. If it goes to the brain, you also have other manifestations such as headache. Now, with colorectal cancer, do not give up. If at all you have a friend who has it, or maybe you are a victim of the same, do not give up. It's very important for all of us to learn the importance of early screening. As a person, if you if you really want to be sure about yourself, then I'll advise you go for what you call colonoscopy. And in colonoscopy, what happens is that there's something like a lighted tube that's inserted through your rectum. So they just want to assess how your colon is, if there are any masses, if they can be removed. So early screening really serves for colorectal cancer. And early screening, you just go to the, especially if you're 50 years and above, you just go to the hospital and you say you want to do a colorectal cancer screening, what you call colonoscopy. Now, management of this disease will depend on the stage. If it's only on the colon, then surgery can be done to try and remove the cancerous part. But if it has spread to different parts in your body, it has gone to your lungs, it has gone to your liver, it has gone to the bones, then management is a bit of high level and surgery may not really play a critical role. So that's all I have for colorectal cancer. If you have any question, feel free to ask, and let's meet tomorrow same time at 8:45 p.m. and that is live with me. We'll be discussing another condition. Thank you so much. Thank you, Michelle. Thank you, Moses, for all that have managed to join this live stream. Thank you so much. Let's meet tomorrow same time, 8:45 p.m. live with Nelima. Goodbye, guys.